Ms. Kira Barrett. This is my presentation for my case study number 2 for intervention recommendations. So just to review, Jay is 3 years old and has a diagnosis of autism spectrum disorder. His behaviors of concern include aggression, crying, elopement, flopping, property destruction, self-injurious behaviors, tantrums, and yelling. Jay has emerging vocals right now with significant deficits in functional communication skills, social skills, and high rates of repetitive and stereotypic play. Jay loves fish, water, cars, and playing outside. The targeted behavior of concern that we're going to focus on for Jay are his tantrums, and those are defined as any episode in which Jay engages in 2 or more of the following behaviors at the same time. So that's the aggression, crying, elopement, flopping, PD, self-injury, or yelling for a time greater than 30 seconds. The episode ends when Jay is no longer engaging in 2 or more of those behaviors for 30 seconds. The function of his tantrums are access to reinforcing items and escape from demands. The recommended intervention to be implemented will be differential reinforcement of other behaviors, also known as DRO. DRO is a behavior modification technique that's used in ABA to reduce or eliminate problem behaviors, in which Jay will be reinforced for the absence of those maladaptive behaviors for a specific period of time. In this case, we decided to implement a DRO procedure and utilize an ocean-themed token board consisting of 5 tokens for Jay. So for the DRO procedure, Jay will be on a DRO of 30 seconds per token, meaning he has to go that full duration without engaging in his targeted behavior. If Jay goes that full duration without engaging in the behavior, he will earn 1 token. If he does begin engaging in the targeted behavior, he will receive 1 verbal warning, such as, hey, we need to have a quiet mouth, or calm body, feet on the floor, or something appropriate for the situation. If Jay continues to engage in the targeted behavior, his timer will be restarted. Once Jay earns 1 token, he can have a reinforcement break. So as Jay makes progress with the DRO procedure, we will either gradually increase the interval or the number of tokens required before he receives that reinforcement. These are the broken down steps for his tantrum behavior. So the first thing we're going to do is block any of those SIBs or property destructions to the best of our ability with those open palms. We will remain neutral and then provide that 1 verbal warning that he gets. Hey dude, we need to have a calm body, quiet mouth, whatever is appropriate, our timer is going to restart. If Jay does not engage in the behavior again or stops engaging in that behavior, we do not restart that timer. We instead provide heavy social praise. If Jay does engage in the behavior again or does not stop that behavior, we'll restart his timer. That timer can only be running when Jay is no longer engaging in those maladaptive behaviors. We wait for de-escalation, and then this is where the function of the behavior comes into play. So if it's for access, we're going to prompt that functional communication. So for him right now, that's just 1-word mands. So for example, car, bubble, shark, or I'm having him man to go. And then we'll provide that first then statement. Cool buddy, first tokens, then that shark. If he can have that item, we will then present the item absent of those maladaptive behaviors. If he cannot have the item, we'll present other items of things he can have, and then begin running his DRO procedure again, as long as his maladaptive behaviors have ceased. If that function of the behavior is escape, we are going to prompt functional communication. So for this, it could be break, or this is too hard, and then mandate for help. We will then reassess the MO, providing a first then statement, and then we'll follow through with that original demand, implementing escape extinction for that demand 1 time every 30 seconds if need be, and then begin running his DRO procedure again as long as those maladaptive behaviors have ceased. This is his current tantrum behavioral graph after we implemented that DRO procedure. As you can see, his tantrum durations have shown an overall decreasing trend since beginning this DRO procedure, and we hope for it to continue. So is differential reinforcement an evidence-based practice? Yes, differential reinforcement has met the criteria to be classified as an evidence-based practice, and there have been studies that show it to be an effective intervention for learners from ages 3 all the way to 22 with autism spectrum disorder. I've included just a few references here that provide supporting information, although there are many, many more if you guys care to look at those. Some, but not all, of the task list items that were considered throughout this intervention process. So for H1, definitions were included in observable and measurable terms for the targeted behaviors. For H2, intervention recommendation was based on the indirect and direct assessments that were collected of the targeted behavior and their functions. H3, the intervention strategy was based on client preferences as well as the learning environment. And of course, social validity and constraints and risks were also considered prior to implementation of this intervention. H4, replacement behavior of FCT was established and described in the implementation steps. H5, we were prepared for the possibility of extinction bursts to occur, and this was also something that was discussed with parents when gaining their consent to begin this intervention. H6, we monitored client progress and treatment integrity during face-to-face consults and by interpreting data collected in those one-on-one sessions. E2, consent from the parents was obtained prior to implementation, and E7, intervention strategies, replacement behaviors, and behaviors targeted for increase or decrease should be discussed with parents or other stakeholders when determining their wishes. And that concludes my presentation. If you have any questions, comments about the intervention, feel free to reach out. Thank you.